A great deal of growth over the last 8 years since my time here as dean. We went from around 1,350 students to almost 3,000 students in all our different majors. Nursing is our largest major. We have over 1,300 students in the nursing major. We graduate 150 nurses every single year from our basic program. We also have about 300 other nurses. We have 300 nurses in our RN to BS program. These nurses come to us with associate degrees in nursing from the community colleges in the region, and they come back to us to get the bachelor's degree. In addition, we have graduate nursing students. The graduate nursing program has continued to grow in Rochester. We have about 150 students in that program. We also have the largest clinical nurse specialist program in the region, and then we also prepare nurses for advanced roles in education and in administration. About 55% of those graduates stay in the Minnesota-Wisconsin region. The largest number annually go to Mayo Clinic for their place of employment after graduation. We also have, and just recently developed, beginning in 2013, the Doctor of Nursing Practice. And we're very proud of that program because these students, the focus of their studies is upon how do they take the research that is out there in regards to best practice, and how do they evaluate the strength of evidence supporting those findings, and then how do they carry those findings in to make real difference in patient care. A very strong program that we have in Rochester is our social work program. That program was started out as what we called a 2+2. Students would go to RCTC for their social services major or their addictions major, and then they would come to us after graduation and get their social work, their bachelor's in social work. Our nursing students and our social work students, our faculty in those programs, are very dedicated to the concept of experiential and service learning. We have nursing students at the Hawthorne Center helping with health education for the adult learners. We have nurse practitioner students at the Alternative Center for the public schools, also at the Hawthorne Center. We have graduate students working with the immigrant and refugee communities in Rochester in terms of helping them improve health outcomes. We also have students down at the public library providing as wellness education to persons that come to the library and can learn more about wellness and healthy living. And so our students, whether they're social work students or nursing students, are involved in the community. And the trade-off is that those students are able to provide services, especially to individuals that may be falling through the cracks, if you will, in healthcare or in social services. We can provide and augment the services that are already available by bringing students and faculty into those experiences. What we do as professionals is becoming more and more focused on community settings. We're dealing more with healthcare issues in primary care and in school settings and long-term care settings rather than more what was traditionally thought of in the acute care areas. And so the faculty have made a deliberate effort in trying to structure the learning experiences for social work students and nursing students that fits the practice they're going to see after graduation. But Rochester has been a rich opportunity, and we like to think that we give back when our students are engaged. That is the privilege of my career to tell people that I serve as the Dean of the College of Nursing and Health Sciences. And I truly mean it is the privilege of my career. And it's not so much of what I do, it's the excellent work of our faculty and the outstanding students that we recruit and graduate.